Good morning. Good afternoon.
Good afternoon, sir.
So am I audible? Taro ra?
Yes, sir.
Okay. So we will wait for the others to join. And pag request to join. Please join now. I cannot accept you once mag-start na ta sa atong lecture. So kumusta ang CDO? Naglinog man dahil kung diha karon? Okay ra mo?
Yes, sir.
Okay. So by next year, kamo na po yung intern, no? Diri sa Cebu. Those who want sa IPI, there's so many changes sa IPI karon, no? Anyway, nag-take down ko kay sa ilang gipadala sa ako nga mga requirements. Lahi naman sad, no? Mga shoe cover, 3 pairs lang tapos karon daghan di kay gamiton. Inana mga changes. So anyway, at least kuha na nato earlier, no? So na naman tayo contact those who want next year nga mag-IPI para ma-finalize. So thank God nga wala na may extend, but we will have additional 1 day duty, no, to replace the February 9 holiday. So mag-duty mig Saturday. Pinag-uol niya itong mag-extend mig until 26. So at least same gihapon namang departure pabalik 24. But additional 1 day sa among duty. Mga mga changes nga. So anyway, take down naman ta. Hopefully by next year, maka-set na ta earlier, makapa-reserve na ta earlier sa ato ang mas mayo siguro March. Mas nindot kay list or list ang we'll just ano lang siguro next year. Okay, so we will start. Ano yung magkuhan? Pa-accept. So far, isa nagpapadlong. Diri sa hotel. Mm-hmm. But since we have some GC with parents, so i-report na yun. Someone wants to join this call. Okay. Pag-delete mo, pwede ko accept na ninyo. So we will continue digestive system. No? We will tackle some conditions or diseases in digestive system and what are the management. Okay, admit. Kompleto na section B. Tekan pa. Start na ni ron. Okay. 47. 46. So pila pa? 64 pa. $93. So let's start. 1 is 1. Online na gani, maliit pag yun. Sa ano pa na pa? $71. Can you view my slide? Hello?
Wala pa po, sir.
Are you still there?
You're not presenting
Hello?
pa po, sir.
Am I audible
Medyo choppy gamay, sir.
Hello?
Choppy gamay, sir.
Ha? Chat. Lost connection. Trying to reconnect. This one.
Yes, sir. Nana, sir.
Okay. So let's continue. So this is your anatomy of your digestive system. Digestion starts with the mouth and passes into your esophagus, into your stomach, and then intestine. And there are some accessory organs to help for the digestion of food that secrete digestive enzymes. So one condition in the digestive system, constipation. Of course, when bowel movement become less frequent, stools become difficult to pass. There are some factors that may contribute to constipation. So sometimes diet or routine or due to inadequate intake of fibers or less fluids intake that will harden the stools that may cause constipation. Now, if you have severe pain, blood in your stools or constipation that lasts longer than 3 weeks, you need to consult. Pili ko ka accept na. Okay, so need to consult if these symptoms appear because we need to determine what really causes the constipation because there's so many causes that may result to constipation. One example is obstructions due to some mga intestinal worms, no? Too much ang imong spaghetti sa tummy or twisted ang imong intestine or some fecal infections, no? There's so many. So in order to determine what really causes constipation, you need to have laboratory procedure or even medication. No? Having fewer than 3 bowel movements a week, technically definition of constipation. However, often it varies widely from person to person. Some people have bowel movements several times a day while others have them only one to two times a week. It depends, no? Kay sometimes, as I said, it magdepende po sa imo water intake, no? Or sa mga imuhang food nga gitake. Okay, regardless of your bowel pattern, one fact is certain, the longer you go before you go, the more difficult it becomes for stool pop to pass. What is the reason for this? Okay, the longer you go before you go, the more difficult it becomes because kung imong pugnan, malibang ka, moiste ang imong stool, so the more ang water ma-absorb, the more mo harden ang imong stool, no? Pag constipate ka. Okay, other key features: visually defined constipation. Your stalls are dry and hard. Your bowel movements painful. Stalls are difficult to pass. Maybe may mga erosion sa lining epithelium, no? Mga sakit. No? One example sa akong patient before na siya ay nakaon o mahilis ang bukog sa isda. In fact, naana sa iyang rectum dapit, no? Ma-feel na nimo ini kuan nimo rectal exam. No, na nagpilit yun sa kuan. This is the reason nga marag sakitan sa it may contract. Taw-taw na kuno siya kalibang, and also sa iyang edad pod, no, minus na ang bowel movement. So that's the reason nga they are from older, they are prone to have constipation. Minus na minom po water, less ng fibers intake. But kato sa iya na siya pain during iyang ipagawas ang kay nakita gid sa iyang stool dayon, no, ma-feel nga may mag-height. You have a feeling that you have not fully emptied your bowels. Kakalibang ka, ginagmay, ma-feel mo nga pag ginabilin, daghan pag ginabilin. That's one symptom that may have some maybe abnormalities sa imuhang digestive system. How common is constipation? Okay, people all ages can have occasional bout of constipation if they kuan sa iyang kung unsa iyang lifestyle. There are also certain people situations that are more likely to lead to becoming more consistently constipated. This is called chronic constipation. Okay, as I mentioned, older age tend to have less active, slower metabolism, less muscle contraction strength along the digestive tract than when they were younger. Being woman, when you are pregnant and after childbirth. During pregnancy, baby inside the womb squeezes the intestine, slowing down the passage of stool. And they are prone for constipation. That is why the first trimester, we don't really give some iron preparation because it can cause constipation for pregnant women. Not eating enough high fibers also. If food moving through the digestive system, high fibers food. No? So, count ang high fibers para maayo ang digestion. Taking certain medication also. Have certain neurological or disease of the brain, spinal cord, and digestive disorders. So, we have to do some laboratory to rule out this type of mga conditions that may lead to constipation. Kung medication ang cause, so at least ma-identify na yun, no? Constipation happens because your colon absorbs too much water, as I mentioned, from west, especially kung dugay yun yung pagawas, punggan pa nimo, which dries out the stool, making it hard in consistency and difficult to push out of the body. Pag PM mo ha, pumawa ko. Napa ko? Pamawala ko signal?
Napa, sir.
Okay. As food normally moves through the digestive tract, nutrients also are being absorbed, no? From the small intestine. Mag-start na lang ang absorption sa nutrients. And going sa imong large intestine, dito na rin ang absorptions, more of the water absorption. That is why muna mugahin na rin itong katong mga gidigest ng food. May muna rin siyang store. If you have constipation, food may move to slowly through the digestive tract, gives colon more time, too much time to absorb water from the west. Stool becomes dry, hard, and difficult to push out. So kung kalibangon ka, libang dayon, no? Ayaw pungi guys, the more na mag-constipate ka. Muna siyang pathway, food waste through colon, rectum, and anus. Can constipation cause internal damage or lead to other health problems? There are a few complications that could happen if you don't have soft, regular bowel movements. One is swollen, inflamed veins in your rectum that may result to hemorrhoids. No? The more mag-utong ka, constraint, so the more mo kuha ng imuhang vein sa rectum. So tendency, pag maagian pagid siya, masamad. No? Tears in the lining of your anus from hardened stool trying to pass through called anal fissure. So sometimes we could identify if there are blood in the stool, no? we have to identify, say, color sa blood so that we could say nga, ana na sa lower part ang asagikan ang blood. No? So kung ang color niya murag black tarry na, so murag na sa upper portion na medyo na samat pa ka ang lining. Okay? An infection of pouches that sometimes form the colon wall from stool has become trapped and infected, condition called diverticulitis. So that is why the longer nga stay ang imong stool, or especially na pagid kay mga na-tear ang imuhang lining sa anus, the more nga prone for infections that may result to diverticulitis. A pile up of too much stool in the rectum and anus, a condition called fecal infaction. So this is what happened to my patient, no? Akong rectal pa, nakita dito nga gahi na kayang stool. Then by applying sa mga lubricant, at least na-manage na siya. Okay? So remember, so lugay na kay itong yung stool na dito nagpundo. So paggawas, mura siya granada ni buto. Lupa din mga nasa ER. Okay? Lugay na gani stay, so baho na kayo. Damage your pelvic floor muscle from staining to move your bowels. No? This muscle help control your bladder. Too much straining for too long, a period of time may cause urine to leak from the bladder, a condition called stress urinary incontinence. It does not have irregular bowel movements, cause toxin to build up in my body and make me sick. Actually, dili gini siya mo ang cause, no? Although your colon holds to stool longer when you are constipated, and you may feel uncomfortable. The colon is expandable container for your waste. And may result slight rest of bacterial infections kaya napundo man siya. If waste gets into existing wound, as I mentioned, no, in the colon or rectum. Now, katong na mga hemorrhoids, no? So, dugay na kay stool ito, muwag ito na nakuha ng blood vessels. So, we mentioned that lifestyle, medication, medical conditions, and also pregnancy. But in pregnancy, at least kung anak na medyo ma-return naman po sa kuano, unlike kung nagi medical conditions or some abdominal or GIT conditions, no? Isod gid siya ikuan dayon, mawala. It need gid siya management. Common lifestyle causes constipation, lifestyle, eating foods low in fiber, not drinking enough water, not getting enough exercise, changes in your routine such as traveling or eating or going to bed at different times, eating large amount of milk or cheese, stress, resisting the urge to have bowel movement, imong pugman. So for the medication that cause constipation, okay, these are the example of medication. No? Okay, so if ever it happens, so think about what medication that the patient is taking. No? Sa imong customer, like, magtubol lagi ko, dugay-dugay na ni siya. You have to ask also. In fact, we have one student also doing inana niya condition, so I explained to wala man po siya medication ko, at least kuhan na siguro sa imong food or less lang tayo imong kuhan sa imong digestive system, but it's good nga you have to do some laboratory. No? Kaya as I said, agad kayo causes. So iron pills, as I mentioned, no? Allergy medications, psychiatric medications, anticonvulsant, anti-seizure medication, anti-nausea and medication. So there's so many drugs that can cause constipation. Always ask your doctor or pharmacist if you have any questions or concern. For medical and health conditions, we have endocrine problems like underactive thyroid gland or hypothyroidism, diabetes also, uremia, hypercalcemia. CA is one, colorectal CA. Especially nga, terminal lang yun siya, then you notice sometimes nanay blood, no? Then irritable bowel syndrome, diverticular disease, outlet dysfunction, constipation also. So with this type of conditions, medical, it really need thorough evaluation to correct the conditions. Also neurological disorder, including spinal cord injury, multiple sclerosis, Parkinson's disease, and patient with stroke. Also lazy bowel syndrome, so meaning the colon contracts poorly and retains stool. Intestinal obstruction, Tapay gusto mo kuan so man ni pag-accept. So, we will accept them ha ato sang kuan stop dire. Kira. Kadugay niyo nanulod. Okay, let's continue. Okay. To continue, intestinal obstruction is one. So makita ini mo sometimes nga ang imong stool no or siya kay mugamay man ang sphincter there is an obstruction. So makita nimo sa nga murag tae sa kanding, that is a sign also no ang imong stool ginagmay putol-putol. So it could say nga na obstruction. Structural defects in digestive tract like fistula, colonic atresia, bulbulus, intussusception, peritonitis, and malrotation. Also multiple organ disease as amyloidosis, lupus, scleroderma, and also pregnancy. So what are the symptoms? You have fewer than 3 bowel movements a week. Your stools are dry, hard, or lumpy. So you will exert too much straining, no? So that may result also sa inflame mo, burot ang imong mga blood vessels sa imong rectum, that may result to hemorrhoids. Sakit na noon ining kalibang. Your stools difficult or painful to pass. You have stomach ache or cramps. You feel bloated and nauseous because tendency ginagmay imong pagawas, no? Then feeling busog lang gihapon ka. Okay? You feel that you haven't completely emptied your bowels after a movement. So diagnosis it will be based on the medical history, kano sa nagsugod, sa mga symptoms, then bowel movements nimo, lifestyle. Okay? So medical history is one. So the question in medical history, what your current and past disease involved? Have you lost or gained any weight recently? Have you had any previous digestive tract surgeries? So these are mga questions, no? The doctor may ask, what medication supplement do you take for other disorder and for the relief of constipation? Does anyone in your family have constipation or disease, digestive tract, okay, mga cancer, history of colon cancer? Have you had colonoscopy? Because if you have undergone this, meaning na mga diagnosis before, no? In bowel movement history, how often do you have bowel movement? What do your stool look like? Have you noticed any blood or red streak in your stool to rule out any conditions? No, like for example, cancer. Have you ever seen blood in a toilet bowl or in toilet paper after you wipe? With the presence of blood, as I said, muas gihapon na nga unsay color, no? To determine asa nga part. So lifestyle habits, food beverages do you eat and drink? Okay, sometimes maski ang milk or cheese can cause, no? What is your exercise routine? So usually with this, no, your doctor will perform physical exam, rectal exam, and also check your vital signs, temperature, pulse, blood pressure. He or she use stethoscope to listen also abdominal sounds. Umayo ba ang peristalsis, ang bowel movement nimo? Abdomen will also be touched to check for pain, tenderness, swelling, and lumps. So once involved gani ang abdomen, so na gina siya abdominal check-up, no? Palpation of the abdomen, kung nabay mamas, no? To roll out, nabay pain. So be aware that your doctor will also perform rectal exam because we determine also kay basig sa rectum dapit ma-feel na to na mass, no? Check for any masses or problems that can be felt by finger. even magkuhan ka ng a condition that involves a prostate, we will do also rectal. Lab test depends on the symptoms, medical history, and overall health. Lab test blood, urine test reveal signs of hypothyroidism, anemia, diabetes. Stool sample checks for signs of infection, inflammation, and cancer. CT scan or magnetic resonance imaging or MRI, lower gastrointestinal tract series be ordered to identify other problems that could be causing your constipation. So this procedure also can be used to rule out major problems in the digestive system. So colonoscopy, internal view of your colon with scope may be performed. Small sample of tissue also will be taken for biopsy. To test for cancer or other problems may be found. Polyps will be removed because polyps sometimes non-cancerous but it may develop to cancer. So it is good to identify polyps before it may result to cancer. Colorectal transit studies. Tests involve consuming small dose of radioactive substance, either a pill, form, or in a meal, and then tracking both the amount of time, how much it's moves through your intestine. Kaya kung na siya obstruction, magpundo ra gyud siya or dugay kay siya mo move, no? Nag-stay lang gihapon sa one area or ginagmay gyud ang pag-move niya. So colorectal transit studies. Then makita po sa nga ang imong stool, ang imong intestine marag nagpurma-purma siya kuan, no? Lagi makita, nagpundo ang stool. Other bowel function tests. Check how will your anus and rectum hold and release stool. Tests include certain types of X-ray, typicography, done to rule out causes of outlet dysfunction, constipation. Insertion of small balloon into the rectum, balloon expulsion test, and anorectal manometry. So how constipation treated? Since also can be involved lifestyle, so self-care. Start by taking inventory of what you eat and drink and then making changes. Kung mayroon mo fluid you take, you have to take more fluid. Drink 2 or 4 extra glasses of water a day. Avoid caffeine-containing drinks and alcohol which can cause dehydration that may result to constipation. Because less ang imuhang body water, it may result to constipation. Add fruits, vegetables, whole grains, and high fibers. Okay, food dairy and single out foods that constipate you. Exercise. Check how you sit on the toilet. Maybe also one factor. Raising your feet, leaning back, or squatting may make having a bowel movement easier. Okay, add over-counter supplement, fiber. If needed, take very mild over-the-counter stool, softener, or laxative. And ask pharmacist or doctor to help in making a choice. Do not use laxative for more than 2 weeks without calling your doctor because overuse of laxative can worsen your symptoms. Kaya katong mahilig o cellphone, sinalibang, no? Or ba na usual kay dalag newspaper, so murag mawala ang imong concentration sa imong paglibang. Okay? Do not read, use your phone or other device while trying to move your bowels. So medication supplement review, self-care. In addition, your doctor will review your medication because it's one of the factor that may result to constipation. Or na kay mga conditions, nag-take kay nani that may result to constipation. Kaya pila siya review. So prescription medication, few prescription drugs available to treat constipation. So these are the example of medication to treat constipation. Now for mga conditions that really need surgery, they may undergo surgery. Recommend surgery if constipation is caused by structural problem in the colon, like intestinal obstruction, intestinal stricture, anal fissure, then rectal prolapse. Also, outlet dysfunction constipation will be treated with surgery. How to prevent? We mentioned, eat well balanced diet with plenty of fiber. Fiber and water help the colon pass stool. And other preventive measures also. Drink 8 ounce glasses of water a day. Not milk, because it can cause constipation in some people. Exercise regularly. Check with your doctor before taking some mga medication. Now, the opposite is diarrhea. Okay? This is loose, watery, possibly more frequent bowel movements, a common problem. Again, isa po sa mga lifestyle po, isa po no, depende sa imong ikaon, sa imong giinom. That may result to diarrhea. Okay, kung makita nimo nga, ay tungod na ni sa akong giinom gabi, grabe kayong beer, no? So, 3 times, 4 times, ay balik-balik ka sa CR. So, at least, kana nga incident, you could say nga, at tungod ni sa akong ikaon, tungod ni sa akong giinom. So, diarrhea is usually short-lived, lasting no more than few days. So, when they last for 4 weeks, usually indicate that there's another problem. Especially associated with abdominal pain, yung mga watery, kung ano imuhang ko, wala naging mga unod-unod. So, grabe na yun imong pagpagawa sa imuhang water sa body. So, there must be another factor na nakakos sa diarrhea. So, infections, no? Bacterial, viral. If you have diarrhea for weeks or longer, you may have conditions such as irritable bowel disorder, and more serious diseases such as persistent infections or inflammatory bowel disease. So, even mga medication like antibiotic, there's some, no? Mag-inom ka na, magkalibang ka. Okay? Signs, symptoms, loose, watery stool, abdominal cramps, abdominal pain. So sometimes with this, we could entertain some infection, no? With abdominal pain, especially with fever, then blood in stool, mucus in the stool, bloating, nausea, urgent need to have bowel movement. With these mga signs and symptoms, sometimes this could say nga na ay some infections that occur. If you're an adult, see your doctor if diarrhea persists beyond a few days and feel become dehydrated, because there's some signs of dehydration, no? Pirmi ka uhaw, sometimes dry na kayo mong lips, no? Eager kayo ka mainom, no? You have severe abdominal rectal pain, you have blood or black stools, you have fever above 102 Fahrenheit or 39 degrees centigrade. So kung kuwang manggod ang imuhang body water, tendency mo increase ang imuhang body temperature. In children, can quickly lead to dehydration. So it is good nga there is a proper monitoring for some even infant, no? Children, if they have diarrhea, because paspas kayo ang ilahang dehydration. That may occur. Sometimes the patient may die due to dehydration if not being managed right away. Okay? So evaluate din na siya. With dehydration, mild or moderate dehydration, and severe dehydration. So management is different also kung sa iyang classification. Becomes dehydrated, has fever above 102, has bloody or black stools. So this is the how to classify, no? Parameters being used for dehydration. The appearance, pag no dehydration, well, alert. With some dehydration, restless, irritable, no? Then severe dehydration, lethargic or unconscious, flappy. So take note ini mga parameters, no? Okay, severe dehydration, wala na. Pag some dehydration, eager pa kinang drink, no? Irritable. Eyes, normal. Sunken. Some dehydration. Very sunken, severe dehydration. But with this sunken eyes, we have to ask also the parents, no? Father, o sabi niya, father baka, na inanin na bagyod ang iyahang mata, basig sunken na gidaan, no? So that we could, evaluate. No? Inana man na siya, katawa pa siya magkalibang, inana man na daan, no? Sukat pa sa una, inana na. Thirst, drinks normally, not thirsty. With no dehydration. Some dehydration, thirsty, drinks eagerly. Yeah, severe dehydration sometimes taken nga, okay na, hindi naman siya giuhaw. This patient have severe dehydration because drinks poorly or not able to drink anymore. Especially unconscious, lethargic. Skin pains goes back quickly. Less than 1 second. Goes back slowly. 1 second. Goes back very slowly. More than 2 seconds. Any abdominal skin pains. So these are mga parameters being used to classify the types of dehydration. So in some dehydration, we could manage, kung ano siya, pwede siya outpatient. No? But we usually advise them to stay, pag punta sila sa hospital, sa OPD, we usually advise them to stay for observation. No? Kay sayang ang bata, biya, dili maging ganahan mo inom, no? Even though, inom siya ginagmay ra gyud, no? Yeah. Sometimes, kini mga malnourished, okay, tanaw, hindi mo makuha ng skin pains, no? Ma-identify nga, dehydrated ba siya, dili. Okay? Yeah, sometimes active siya. Okay? It happens sa one of my co-PGI. Okay, some dehydration, give I stay, but usually niuli pagbalik ko na severe dehydration. So wala niya ma-monitor because niuli man. Okay? Imbes nga give I stay lang sa ER, there is one room sa ER nga for monitoring so those mga children with some dehydration. Okay, sometimes with proper giving some fluids, maulian ra sila. Okay, so no need nga i-admit. But if the next observation nga it seems nga severe dehydration, at this time we have to admit. Kay mapuno man gud ang hospital sa government kung mga sign dehydration i-admit dayon ya. What if kung nanay maabot mga severe cases, wa nay bed. No? So nay isa ka room for monitoring for those type of patient. Huwag yapon ni siya, no? Ang iyang management, no? Based on sign and classification and what will be the identified treatment for the classification. Okay, so two of the following signs, lethargic, unconscious, sunken eyes, not able to drink or drinking poorly, skin pains goes back very slowly, severe dehydration. Two of the following signs, restless. Two of the following, irritable, sunken eyes, drink eagerly, thirsty, skin pains goes back slowly, some dehydration. Not enough signs to classify some or severe dehydration, meaning no dehydration. So, causes of diarrhea, viruses. It's one, norovirus, cytomegalovirus, and viral hepatitis. Rotavirus is a common cause of acute childhood diarrhea. Rotavirus. Also coronavirus, no? That is why mga patient itong nagka-diarrhea, fever, na maklasify na yung COVID. Vomiting, even though lahi ang cause. Okay? Considered na dayon. So, wala diri karon sa API, ayaw kita mo, kanina sa ayaw kita mo yung niyon, naghilantan mo ha, kaya basig, di na mo kapadayon for 3 days, ipapalikon ra pag yun duty. Okay, sige, monitor sa mo. Okay. Bacterial parasites, contaminated food or water can transmit bacteria and parasites to your body. Now, in traveling in developing countries, diarrhea caused bacteria, parasites often called traveler's diarrhea. Okay, most common of the cause of traveler's diarrhea is the E. coli. I mentioned before antibiotics. Clostridium difficile is another type of bacteria that can cause serious infections that cause diarrhea occur after a course of antibiotics or during hospitalization. Okay. Clostridium difficile. So medications, okay. One, antibiotic, no? Cause diarrhea. Because antibiotics are both good bacteria which can disturb the natural balance of bacteria in your intestine. Other drugs that cause diarrhea are cancer drugs and antacids with magnesium. Also lactose intolerance, especially mga infant, no? Taking some infant formula. Sugar found in milk and other dairy products. People who have difficulty digesting lactose have diarrhea after eating dairy products. So, lactose intolerance can increase with age because levels of enzymes that help digest lactose drop after childhood, the lactase. Fructose, sugar found naturally in fruits and honey. Some has added a sweetener to certain beverages. People who have trouble digesting fructose, it can lead to diarrhea also. Also, artificial sweeteners found in chewing gum and other sugar-free products. Surgery. Am I audible? Okay pa? Para ko mawala? Okay.
Yes, sir.
Surgery. Abdominal gallbladder removal surgeries can sometimes cause diarrhea. In gallbladder removal, wala na kay katong enzymes to digest para sa imuhang fats, no? Kay ang function sa gallbladder, it release or secrete some enzymes needed for the metabolism sa imuhang fats. So tendency, kung ano may mahitabo, no? Nagkaon ka mga fatty foods, diretso na mo kalibang, oil na siya. Chronic diarrhea has a number of other causes: Crohn's disease, ulcerative colitis, celiac disease, microscopic colitis, irritable bowel movements. So again, this could be examined or there will be a laboratory workup to rule out this type of condition that may result to diarrhea also. So complication, the major complication of diarrhea is dehydration because patient die due to dehydration, life-threatening if being untreated. Indication of dehydration, again, we mentioned already, excessive thirst, dry mouth or skin, little or no urination. Sa mga infants, sometimes we have to monitor kaya naka-diaper. Tanaw na itong diaper kung daghan mag-ihi, pila naka-oras, maura gihapon, dry lang gihapon. So meaning there is no urine output. Maybe dehydrated pa ang patient. No? So sa diaper, tanaw. Weakness, dizziness or lightheadedness, fatigue, dark-colored urine. Indication of dehydration in infants and young children is included not having wet diaper, as I mentioned, in 3 or more hours, dry mouth and fever above 102 Fahrenheit. Crying without tears is one also. Sige hilap o giluha, no? Sa adult, kini mag-cry without tears, kung ano na siya, kanang drama ro na niya, especially mag-away, o ilak-ilak dayon. Okay? Drowsiness, unresponsiveness, or irritability. Sunken appearance to abdomen, eyes, or cheeks. Preventing viral diarrhea. Wash your hands, prevent spread of viral diarrhea. Ensure adequate hand washing. Okay. And washing with soap, no? At least 20 seconds. Use hand sanitizer when washing is not possible. Alcohol. Vaccination. No? Protect your infant from rotavirus, which is the most common cause of viral diarrhea in children, the rotavirus. Take note. One of the 2 approved vaccines for this type of conditions. Okay? Ask your previous doctor about having your baby vaccinated. Then, preventing traveler's diarrhea. To reduce traveler's diarrhea, watch what you eat, no? Eat hot, well-cooked foods, especially travel ka, then nag-stop ang bus kay mga onsa mo, no? Avoid raw fruits, vegetables unless you can peel them yourself. Okay? Sa kinsa na nagunit ang mga mansanas diha, sa bana diha, no? Diretso rin mo kaon, nagpili-pili, ugaw kayong kamot. Okay? Watch what you drink. Drink bottled water, soda, beer, or wine. Serve in its original container. So especially pag nag-travel ka, because you don't know kung unsa gyud ka kung asa lagi ka ng water, no? Mga karinderya. So, then antibiotics, we mentioned to ask your doctor about it. If you're traveling to the country for extended time, ask your doctor about it before you go. Check for travel warning, Center for Disease Control. Kanang lugar diha, prone siya kayo magkalibanga, okay, maybe ang ilahang water source, so at least maka-try ka you have to drink your bottled water. So diagnosis, again, medical history. Siya kalibang, ano sa sugod, associated mag-abdominal pain, napay blood, okay. Then review medication you take, video to say medication. Then conduct physical exam and may order test that what's causing diarrhea. Blood test, blood test can help indicate what's causing diarrhea. It will be bacterial, viral infection. Stool test to see if bacterial parasite also is causing your diarrhea. And in severe cases, we do some flexible sigmoidoscopy or colonoscopy. Sige man yun siya kuhan. Dito, we need to determine inside, no? The device also equipped with tool that allows your doctor to take small sample of tissue from your colon. The flexible sigmoidoscopy provides view of lower colon, while colonoscopy allows the doctor to see the entire colon. Treatment. Most cases, diarrhea clear on their own within a couple of days without treatment. It depends, no? Unsay naka-cause. But again, be sure na you have to replace water loss, body water loss. Maybe diarrhea, you mentioned, but it's lifestyle. But with the presence of infections, mas kuyaw siya. Antibiotics might help treat diarrhea caused by bacteria or parasite. If a virus causing your diarrhea, antibiotic won't help. So it needs really proper laboratory tests to identify what's really causing the diarrhea. So replace fluids. Replace fluids and salts. For most adults, that means drinking water, juice, or broth. If drinking liquid upsets your stomach or causing vomiting, your doctor might recommend getting IV fluids. Okay? Because even mga children, no, we give some mga Pedialyte for some dehydration. But since lain maglamig, no, so maski mga ORS, no, lain maglamig, so they will vomit. The more they vomit, the more dehydration may occur. So it needs really mga IV fluids. Especially makita na nimo nga parang padung na maginig severe dehydration. So water is a good way to replace fluid, but it doesn't contain the salts and electrolytes, minus as sodium and potassium, because during diarrhea, mawala mo ni siya, no? So you keep only drinking some water lang without this, so dili kayo siya ka-help, no? But at least makakuha ng dehydration nimo. But you need to replace kung sa'yo nakuha ng sodium, potassium sa iyong body. They are essential for your body to function. So maintain your electrolyte levels by drinking fruit juices for potassium or eating for sodium. Tatagsabaw. So ask your doctor about using oral dehydration solutions such as Pedialyte to prevent dehydration or people lost fluids. So may Pedialyte 30, Pedialyte 60. So paano mo ang 30 or katumay fever, in 60 for diarrhea, but the problem is lain lagi siya lami, no? So, but it can help kung okay lang ang bata, no? Inom, dago-dago na. Okay. Then conditions, GERD or gastroesophageal reflux disease. Okay. So, I compare with the healthy and with GERD. So this is an acid reflux. So instead nga mo close ang sphincter, mo open sa permit. That is why there is a backflow of the acid from the stomach. Gastroesophageal reflux disease. A long-term condition where the acid from the stomach comes up into the esophagus. Fast facts on GERD. Stomach acid that washes up in the esophagus cause dangerous tissue damage, no? Due to acids. That is why even mga suicidal attempt, no, mga acidic ilang gipang inom. Ang management is dili nimo siya pasukaon because tendency pag imong ipavomit mubalik ang acid, so it can cause some damage, tissue damage sa imong esophagus. So GERD may result from dysfunctional bowel at the top of the stomach and bottom of the esophagus, as I show in the picture. So treating GERD may also use protein pump inhibitors, antacids, and other medications as well as lifestyle changes. So a condition where stomach acid persistently regularly flows up into the esophagus. So heartburn due to acid reflux. Esophagus cause heartburn and other symptoms as well possible tissue damage. Kung magsige na lang yun siya, no? Causes. Occasional acid reflux quite common after often occurring as a result of overeating, gluttony, lying down after eating, or eating particular foods. So, however, recurrent acid reflux diagnosed as GERD typically have other causes, risk factors, and have more serious complication. Then, in short, GERD occurs when the sphincter of the bottom of the esophagus becomes weak or opens when it should not. Commonly in people who are overweight or obese because of increased pressure in the abdomen. Pregnant due to same increased pressure. Taking certain medication like some asthma medication, calcium channel blockers, antihistamines, sedatives, antidepressants, smoking, and being exposed to second-hand smoke also. Next condition is hiatal hernia. A condition when opening of the diaphragm lets the top of the stomach move up into the chest, lowers the pressure in the esophageal sphincter, and raises for rest of gastroesophageal reflux disease. Hiatal hernia. Main symptoms: heartburn. Discomfort felt become the breastbone as burning sensation. Tends to get worse if the person lies down or bends over and also after eating food. So mo puno, then mo awas ang iyahang acid, stomach acid, so mo backflow. Not all people with GERD experience heartburn, and there are other possible symptoms: nausea or vomiting, bad breath, respiratory problems, difficult or pain swallowing, and tooth decay because of too much acid. No? So complication, GERD can worsen and turn into other conditions if left untreated, like inflammation of the esophagus, esophagitis. In esophageal stricture, esophagus become narrow, making it difficult to swallow. Barrett's esophagus, cells lining the esophagus can change into cells similar to lining of the intestine. And sometimes Barrett's esophagus can develop into cancer. Respiratory problems, possible to breathe stomach acid into the lungs, which can cause range of problems including chest congestion. Isip ka pa sa imong ginawa. Hoarseness, asthma, laryngitis, and pneumonia. And respiratory problems that may cause due to gastroesophageal reflux disease. Again, diagnosis. This gihapon sa symptoms, no? Okay, there are several possible tests to diagnose esophageal pH and impedance monitoring. Measure the amount of acids in the esophagus while the body is in different states, such as while eating or sleeping. The upper gastrointestinal endoscope tube with camera attached, which is used to inspect the esophagus. A small sample of tissue may also be taken at the same time in biopsy. And upper GI series, the X-ray that shows up certain physical abnormalities that might cause GERD. Esophageal manometry, Bravo wireless esophageal pH monitoring. So measure acidity content for about 48 hours. Bravo wireless esophageal pH monitoring. Treatment. Okay, will often be treated with medication before attempting other lines of treatment. Proton pump inhibitors. 1. Decrease the amount of acid produced by the stomach. Other options is to blockers, antacids, prokinetics. Help the stomach empty faster. Side effects include diarrhea, nausea, and anxiety. But dili na kayo siya yung dangerous. Erythromycin, type of antibiotic, can also help empty the stomach. Surgical options. If lifestyle change do not significantly improve the symptoms, o feel ni mo marag kasi stop na kasi mong kuhan nga. Sa ipagtignan mo kay English acid, wala na naalang gyud gihapon, no? So surgical. It depends on sa result sa imuhang mga laboratory procedure. Okay, fundoplication, surgeon sews the top of the stomach around the esophagus. This adds pressure to the lower end of the esophagus and is generally successful at reducing reflux. Endoscopic procedure also. Prevention, lifestyle. Eat moderate amounts of food, avoiding overeating, stop eating 2 to 3 hours, quit or avoid smoking. Person overweight, losing weight can help prevent symptoms. Do not wear clothing that is tight around the abdomen. Sleep at night, angle with head slightly elevated. Diet. Okay. Certain foods may triggers. GERD symptoms in some people, like greasy food, spicy food, chocolate, peppermint, coffee. Foods containing tomato products. Alcohol drinks. Okay, viral hepatitis, an infection that causes liver inflammation and damage. Inflammation, swelling that occurs in tissue of the body become injured and affected. Okay, inflammation can damage organ, can be sudden illness, mild to severe course followed by complete resolution called acute viral hepatitis and can cause by all other viruses. Also have a prolonged course of active disease or silent asymptomatic, that is chronic viral hepatitis. So parenterally blood to blood transmitted hepatitis B, C, and D. Ang common kayo sa blood transmission is the C. And then the D can only occur if there is a presence of hepatitis B virus. Okay, mo share man siya mo. Once siya gumurag cloth, no? Sa hepatitis B. Kung wala hepatitis B, wala siya makuha nga sa ating cloth para ma-survive siya. Several different viruses can cause hepatitis, including A, B, C, D, and E. Okay, I think this is a review on micro, no? Hepatitis C and E, fecal oral, contaminated, infected person's stool by food or water. Eating undercooked pork, deer, or shellfish. But the virus may use only acute or short-term infections. The acute infections, your body is able to fight off the infection and the virus goes away. B, C, and D spread through contact with infected person's blood. They can survive with the presence of blood. Okay? So, dili kay mahadlok itag na hepatitis B as long wala contact sa blood. No? B and D may also spread through contact with other body fluids. This contact can occur in many ways, including sharing drug needles or having unprotected sex. So magtapad ra mo dili ra, no? Kaya may presence of blood. Kaya kapag na hepatitis B mo kauban, okay ra na siya, no? So kung mag-sex, okay, unprotected, okay na isa po na siya. Then hepatitis B, C, and D can cause acute chronic long-term infections where hepatitis form in your body is able to fight off the hepatitis virus, and the virus does not go away. Can lead to complications of cirrhosis, liver failure, and liver cancer, especially not being managed right away. For early diagnosis, treatment of chronic hepatitis can prevent or lower the chances of developing this complication. Hepatitis A, viral infection that cause liver inflammation and damage also. Invade normal cells in your body, cause infection that can spread from person to person. Spread to contact with food, water that has been contaminated. So acute or short-term infections. Sometimes hepatitis can be severe, lead to liver failure, and need for emergency liver transplant to survive. So protect yourself from hepatitis by getting hepatitis C vaccine. How common? Common in developing countries where sanitation is poor, access to clean water is limited. Common in Africa, Asia, Central and South Africa, Eastern Europe than in the United States. Who is more likely to get hepatitis A? Travel to developing countries, have sex with infected persons, are men who have sex with men, usually, no? Use illegal drugs. Experience stable housing, homeless, live with or care of someone who has hepatitis A. Live with or care for a child recently developed from country with hepatitis is common. Complication may lead to liver failure. Common adults older than 50 and people who have another liver disease. Symptoms: dark yellow urine, diarrhea, feeling tired, fever, gray or clay-colored stools, joint pain, loss of appetite, nausea, pain, abdomen, vomiting, yellowish skin, eyes and skin, called jaundice. But sometimes yellowish of the skin, we could also consider some gallstone. No? Contact can occur by eating food by an infected person. Okay, we mentioned already, drinking untreated water or eating food was in untreated water. Placing finger or object in your mouth that came in contact with infected persons. Having close person contact with infected person. You cannot get hepatitis C being cough or sneeze or by infected person. Sitting next to an infected person. Hugging an infected person. Baby cannot get hepatitis C from breast milk. Diagnosed by symptoms and blood tests. Okay, so hepatitis virus called immunoglobulin A antibodies and show whether you have acute hepatitis. Will be detect antibodies. Okay, and how doctor treat hepatitis? Resting, drinking plenty of fluids, eating healthy foods to help relieve symptoms. And medication, it depends on what really the extent of the damage. No? How can I protect? By getting hepatitis C vaccine. Hepatitis viral infection causes liver inflammation and damage also. So, it's spread to with infected person's blood, semen, or other body fluids. So, morose pass. Properly screen for some other infections like hepatitis. Is kaya okay ra ka, kaya operahan ng kanig kog blood transfusion, the problem is wala may screen for some infections, natakdan ni noon ka. The short-term infections, some people have symptoms in the last several weeks, some cases symptoms last up to 6 months. Chronic, long-lasting infection. Chance of developing chronic hepatitis greater if you were infected with the virus as young child. People likely to get hepatitis B, they are born to mother who has hepatitis B. Virus can spread from mother to child during birth. People are also more likely to have hepatitis B if they are infected with HIV because hepatitis B and HIV spread in similar ways. Men who have sex with men, injected drug use, or work in occupations such as healthcare, in which they have contact with blood, needles, accidental prick, no? or body fluids at work. Live or work in care facility for people developing mental disabilities. Have diabetes because weak ang mga immune system, they are prone to have other diseases. Live or work in a prison, have blood transfusion or organ transplant. Should I be screened for hepatitis B? Testing for disease in people who have no symptoms. Use blood tests to screen for hepatitis B. Screening tests help diagnose treat hepatitis B, which can lower your chances of developing serious health problems. Recommend screening for hepatitis because it can be transmitted to the child, so pregnant women. It must be screened. Okay, or those HIV positive, injected drugs, sharing of needles, men who have sex with men also. There's chance of infection due to other factors. What are complications? So acute hepatitis B complications lead to acute liver failure. The liver fails suddenly. People with acute liver failure may require liver transplant. Yan ang makadaog sa loto ng liver transplant. Chronic hepatitis B complication can lead to cirrhosis, scar tissue. Cirrhosis gets worse, liver begins to fail. Liver failure, in which your liver's body damage and stop working. It is also called as end-stage liver disease, liver failure. Required liver transplant with those liver failure. Reactivated hepatitis. People who have ever had hepatitis B, the virus may become active again. tuberculosis, or reactivated later in life. When hepatitis is reactivated, it may start to damage the liver and cause symptoms, especially mag-decrease ang imong immune system. Can lead to liver failure, the reactivated hepatitis B also. People at risk for activation hepatitis include those take medicines that reduce activity of the immune system. As I said, decrease ng immune system. For example, siya, tuberculosis or other mga disease. Pag mo decrease ng immune system, mo reactivate. Medicines prescribed to treat conditions that involve immune system such as inflammatory bowel disease, rheumatoid arthritis, and psoriasis. It's HIV infections. So with HIV infections again, mo-decrease yapon ng imong immune system. So symptoms, again, dark yellow urine, failing tired, fever, gray or clay-colored stools, joint pain, loss of appetite, nausea, pain in abdomen, vomiting, yellow eyes, skin, and cold jaundice. So contact can occur, being born to mother with hepatitis B, having unprotected sex with infected person, sharing dark needles, getting accidental stick with needle that was used in an infected person. Ini mga tattoo, that is why they're not allowed to donate blood for those people with tattoo, purse with tools that were used on infected persons and weren't properly sterilized. Mga kilid-kilid na magpatattoo, no? Mag-share lang. Mag-share magyapon ang needle gamiton, no? Ana. Okay, razor, toothbrush, or nail clippers also. Mag-share, no? Pati kung nasamad, okay? May blood itong sa razor, then ikaw nasamad po ka. Kaya nag-share lang mo. You cannot get hepatitis B from being cough or sneeze or by infected persons. Okay. Again, infected persons, dilipod. Shaking hands, dilipod. Okay, mothers who have hepatitis can safely breastfeed their babies. If a baby receives hepatitis B immune globulin and starts receiving hepatitis B vaccine to prevent hepatitis B infection shortly after birth. Again, hepatitis B is unlikely to spread from mother to child through breastfeeding, only during birth. So history for the diagnosis, physical exam, blood tests. So medical history, family history asks symptoms about factors that may you likely to get hepatitis B. That's whether have family history, hepatitis B or liver cancer, as about factors that could damage liver, such as drinking alcohol. So physical examination, check signs of liver damage. Change in color, skin color, yellowish of the skin, swelling in your lower legs, edema, feet or ankles, tenderness or swelling in your abdomen. Use blood tests to diagnose hepatitis. Blood test may order one or more blood to whether you are infected hepatitis B and can identify either acute or chronic. Whether you have increased chance of liver damage. Levels in your body is high, whether you need treatment. Hepatitis B, pero hepatitis time change damage your liver in the future. Treatment. Typically, don't treat hepatitis B unless it becomes chronic. Treat chronic hepatitis B with antiviral medications that attack the virus. So medicines that take by mouth. Ano mga medication, no? Okay, the length of treatment varies. Hepatitis medicine may cause side effects. More never problem, no? Kaya na kay mga medication, sometimes you may develop side effects. Sometimes it can damage also your other organ. Treat ka, but you have another conditions because of the side effect of medications. Now, for those who have decreased immune system, there are some medication, antiviral medication, the more na mo decrease ang immune system. So, review topics for viral hepatitis. No? There are 5 RNA viruses. Because the hepatitis B is the only DNA virus. So ACDEG is the RNA viruses, B is the DNA virus, viral hepatitis. So previously, hepatitis C, wala siya ma-identify, no? It was being, detect nga, this type of hepatitis virus is non-A, non-B until it was being isolated as hepatitis virus. And ay mga blood transfusion, na-detect ano nagka-hepatitis man ni ang patient. No? Kaya common kasi sa blood transfusion ng hepatitis C. So it was being named non-A, non-B before. And it was being isolated na hepatitis virus, common kayo sa blood transfusion. Okay, we mentioned the DNA virus, hepatitis B is the only one. So this is a review of your micro. Okay. Viral hepatitis can be sudden illness with mild to severe course followed by complete resolution. Blood to blood, transmitted B, C, and D that can cause chronic hepatitis. So has variable incubation for acute viral hepatitis period depending on the virus type. So growth of virus first results in systemic symptoms much like flu, fatigue, low-grade fever, muscle joint pain. Sometimes it could be mistaken as respiratory symptoms or conditions. Until the end, nagilo naman ko. Okay? Nagilo na. And then it seems involved ang iyahang liver. As the virus grows in hepatocytes, these liver cells necrose or die. Hepatocytes produce enzymes that are released during liver function enzymes that could use for tests. No? Aspartate, alanine, AST, ALT, and GGT, and alkaline phosphatases. Elevated blood levels of these liver enzymes help establish diagnosis of hepatitis. About 2 weeks into the illness, the patient is often jaundice, has painful enlarged liver, high blood levels, or liver function enzymes. And chronic viral hepatitis is more difficult to diagnose because patient of it asymptomatic or sometimes siya mga respiratory symptoms lang. With only enlarged tender liver, mildly elevated liver function enzyme levels. Okay, so patterns of liver enzymes, elevated disease result in different patterns of liver function enzyme elevation. For example, viral hepatitis usually causes transaminase, so ALT and AST to elevate to very high levels. While GGT, alkaline phosphatase, and bilirubin mildly elevated. But as the disease progresses, bilirubin levels rise higher. Kung mag-yellow na dayon due to severe higher bilirubin. Gallstone, as I said, you have to roll out sometimes pag nag-yellow ang patient, no? Causes opposite to occur. So, ma-roll out din siya because bilirubin, alkaline phosphatase, GGT rise higher than ALT and AST with gallstone. Ano siya ang picture, no? Hepatocytes produce AST and ALT, cells that line the bile caniculi produce alkaline phosphatase and GGT. Bile caniculi carry bilirubin. Okay, so viral hepatitis, cell necrosis, hepatocytes rupture resulting in the release of AST and ALT. Muna mahitabo sa laboratory, no? May increase, then some pericardial cells will also be destroyed. Very high AST and ALT with little elevation of alkaline phosphatase and GGT. As the infection worsens, the liver swells and the caniculi narrow, resulting in backup of bilirubin into the blood. That may result to jaundice. So with viral hepatitis, ALT, AST very high, and bilirubin, alkaline phosphatase, and GGT rise later in the course. And a stone blocking the bile duct would result in ability to exert bilirubin, resulting in high blood levels of bilirubin. Sa gallstone. Backup cells increase alkaline phosphatase and GGT synthesis by caniculated cells. Backup pressure propping the cells resulting release of alkaline phosphatase and GGT. So with stone in the bile duct, AST-LT would only be minimally elevated. Alkaline phosphatase, GGT bilirubin would be very elevated. To differentiate the conditions in the gallbladder and the liver. Serologic test helps establish diagnosis. So with hepatitis virus capsid is antigenic, resulting in host production of anti-HIV immunoglobulin and later the anti-HIV hepatitis immunoglobulin G. Patient active infections will have anti-hepatitis virus IgG, IgM detectable in the serum. With anti-hub, IgG indicates all the infections and no active disease. Okay, so ano siya, no? With IgM anti-hub positive, there is acute infection. With IgG anti-hub positive, there is all the infections, meaning the patient is immune to hepatitis A virus. Now, if both negative, there is incubation or no infections. This is how to read the serologic test. Okay. So treatment, new vaccine available and may given people who have risk of hepatitis virus infections. The pooled immune serum is obtained by ethanol fractionated from the plasma of hundreds of donors. Anti-hub IgG is present in about 40% of the population. There will be antibody in the pooled immune serum globulin that will inactivate the virus. Sub B, in an infected patient, if the virus lives in all human body fluids, semen, urine, saliva, blood, breast milk, to health workers, you will come into contact with patients who harbor this virus. And since hospital work is considered to be a rest group, they will receive immunization against hepatitis B virus. So epidemiology, blood-to-blood contact, no? Parenteral transmission. And this type of virus is extremely contagious. Needle sharing, accidental medical exposure, needle stick, blood spray, touching blood with unprotected hands, sexual contact, blood transfusion, perinatal transmission. That is why in the emergency room, pag na ay mga traumatic cases, no? Pang pusil, pang dunggap, presence of blood. So usually we don't really touch the patient right away without gloves. Dapat protect yourself first. Kaya mo na-treat na kuha mo ang patient, but the problem is ikaw na po. Kinaden siya hepatitis B niya. You don't know na kay even mga scratch, no? Gamay na kayo nga samad, no? So na-touch ni mong patient na yan. Always protect yourself. Okay? Puna mo sa emergency room. Or any place nga na yung mga inanak, no? Always protect yourself. Kaya you don't know, kasi na positive hepatitis, yan, nakaisamad kamay sa imong hands or fingers, no? So, gikan ka na pagkuhan, ingron, gipaibot, sa pa. Okay. So, following our disease that caused by hepatitis, acute hepatitis, fulminant hepatitis, or severe acute hepatitis with rapid destruction of liver, chronic hepatitis, asymptomatic carrier. The carrier patient never develops antibodies against hepatitis surface antigen and harbors the virus without liver injury. Chronic persistent hepatitis, patient has low-grade smoldering hepatitis. For chronic active hepatitis, patient has acute hepatitis state, continues without the normal recovery, lasts longer than 6 to 12 months. Then also co-infections in hepatitis delta virus. So, as I said, it's D-B, dili siya mo appear without hepatitis B. So, the management for hepatitis D virus is the prevention of hepatitis B. Okay. So, na possibility, appear na silang luha pag na hepatitis B. The liver injury appears to occur from cell-mediated immune system attack hepatitis B virus. Viral antigens on the surface of infected hepatocytes target for cytotoxic T cells. Immune complexes of antibody, its base antigen, can deposit in tissues, activate the immune system, resulting in arthritis, as well as skin and kidney damage. Malnutrition, AIDS, chronic illnesses are more likely to have asymptomatic cares because the immune system does not attack. So, dili man nimo makita nga kuan, ma-feel nimo nga wala na lagi ko yung mga symptoms na kuan because with that symptoms meaning active ang imong immune system. For those mga inani, wala na, no? Pero kung gihapon alawa na fever akong anak, dengue, okay na. Without knowing decrease na yung immune system, wala na fever. Pero severe na case, no? Nana. Complication, primary hepatocellular carcinoma is a complication of hepatitis B. Chronic infection, the hepatitis B DNA become incorporated the hepatocyte DNA triggers malignant growth. Also, this may result to cirrhosis or liver scarring and loss of hepatocytes. So, serologic test, presence of its base antigen. Okay, so I think it's time. Hindi na tayo extend, no? Or can we extend? Pwede ra? Okay, kini lang. Last, no? Always means there is live virus infection, either acute, chronic, or carrier. When antibodies base antigen develops, hepatitis B surface antigen disappears and the patient is protected immune. So its base antigen, there is disease or chronic or acute. With anti-its base antigen, patient is immune, cure, no active disease. Ano siya ang serologic test? Okay? Kindly, this one, familiarize with the serologic test for hepatitis B virus. Positive, it's BS. Positive, it's B antigen. There is acute hepatitis B virus with immunoglobulin M. The chronic hepatitis B, high infectivity, positive, it's base antigen. Positive, it's B antigen with IgG. Positive. Chronic hepatitis B virus, low infectivity, positive, it's base surface antigen. And anti-its B antigen positive with IgG. Recovery, anti-its B antigen positive, then anti-its B antigen positive with immunoglobulin G. Pag immunize, anti-its B antigen positive. So, there's so much slides to present, but since we don't have time anymore, I want you to study the slide I'm going to share to you. Akong i-upload. Okay. So, I think our schedule is Wednesday. So I'll just let you study the slides. And regarding sa laboratory, there's a similarity of the questions because my activity is the same with the lecture. So, nalay similarity sa mga questions sa laboratory. No? And on February 17, it seems dili ko ka-online sa inyo because we have an extension of 1 day sa IPI to replace katong February 9 as I mentioned. So, okay na mo? Okay ra mo? Hello? Nangatulog mo siguro mo? Okay
Yes,
ra?
sir.
No, so, I hope, I'm going to upload my slides, no? Taas lagi kaya, sige lang kay sayang man po dili niyo mga kung ano matakol mabasa hangak yun pason, no? Sige lang. So you just read lang kay at least it can help also, no? Sa review ra magyapon ang hepatitis wala naman na sa atong kuan. Mana na sa atong micro sa other conditions no man naman na mention. So Ano lang, so by so there will be maghahatag lang ko ni Ma'am Lois no sa kuan clean farm. So kung siya gi-lecture mo na similarity as I said na similarity sa laboratory na tong mga questions. And then as I said by 17 dili ko ka online because I have to still accompany them. Kay dili pwede nga di ko yoga no. Kay sometimes namon kay mga lain na paminaw sa interns o the ITI personnel or HR, they will call the faculty. No? Na naimuhang estudyante sa kuan clinic. No? It happens before. Inanagip sa una. No? Anyway, we will have also orientation sa inyo ha before mo i-deploy. Okay, so which do you prefer? Sa notebook or sa kuan na lang? Sa ni? Bond paper, long bond paper. Pero sa long bond paper, same lang gyapon handwritten kay ang may tabo mo copy paste dili basahon. Written. Submit sa G-class niya encoded copy paste ra man good. So para din lang mo mobile yung notebook sa kuan na lang. Sa bond paper, long bond paper. Dapat run handwritten. Kay tendency mong good bond paper, white. Coverage, kindly read all of these slides. No? Akong i-upload karon para sa prelim. Listen man din yung mabasa. O sige, katong last portion mo na yung mugawa sa board exam. Okay. Okay. Okay, so questions, clarifications? Isa naman siguro kay schedule gihatag ni Ma'am Lois sa Clean Farm. That would be Lick and Lab. Short ra short. Okay? Okay, mag-upload lang ko, mag-upload ra ko. Mag-send ra ko ni Ma'am Lois, share mo friend. Also sa akong anatomy. So questions? So lecture first, then laboratory. Okay. So pag-prefer na mo sa inyong self, kay tendency, no? Nga, kung sure na sa kuan, sa interested mo sa API, actually, nagi mga improvements sa API karon no? Unlike before, marag delegate sa ingon nga, dali ra nga, hands-on, kadali ra. But this time, nagid mga kuan na nila, lecture nila, which is related sa manufacturing. No? Ma-recall yun ninyo yung manufacturing subject, nga lecture, mga topics. Tana. Okay, so, long, lagi long. Tapos short, oy. Long bond paper para uniform. Okay? Sa 3B, sir, murag sa amuan, nakapalit na sa notebook. So, okay na. Kung nakapalit mo, katong wala pa, pwede ra sa bond paper, hana na lang. Okay? Everything under the sun. Multiple choice exam. Everything under the sun gihapon. Sir, submit ba physically or i-scan lang din submit? Submit dito sa office. Ako instruction. Instruction man to, di ba? Okay. Kaya iparate ko sa notebook, meaning i-submit ko dito sa office. Kung wala, so meaning, ang instruction sa notebook, so i-write sa notebook, submit sa office. Okay, so sige, kung wala maingnan sa 3A, masiksa anatomy, surto na ako naingnan ako. So, ikuha na lang, sa 3B na kayong sure kong notebook. Pero pwede ra, kung nakapalit na o wala, pwede ra bond paper. Okay? Okay. Pero kung ano, na deadline? May deadline. Okay, good kay diri sa hotel kusog ang signal nakagamit ko. So mag-prepare na mo if ever katong we will sa inyong community but also okay. Kung maka-intern na gyud no, sa community have to contact also sa Watsons no. Mag-deploy ta sa first semester sa community sa Watsons and other katong mga affiliated po also na naka-deploy na ta no. Ang Watsons may wala, Rose naka-deploy. Ang Mercury wala pa, so Mercury Watsons mo akong i-work no. Anyway, na ako'y contact person sa Watsons to also sa Mercury. So kung ako mo trabaho ani kay wa naman ta internship coordinator. Ilang pakaya ra lagi ni hinahinayan para mahuman lagi internship. Okay? Pero during inigbalik na ako diha, mag-advance na ko orient ninyo diri bahin sa kuan sa ITI for those who are interested no. Karon dili mahitabo ang sinitabo sa kini nga time karon no. Na ma-aware na mo sa pila expenses, sa mga policies no? Okay? So if any questions then bye-bye. God bless. Kay mag-anatomy na pod ko. Thank you for attending my online class.
Thank you, sir.
Bye, sir.
Have a nice day.
Goodbye, sir. Thank you.
Okay.
Thank you, sir.
Thank you, sir.
Goodbye, sir.
Okay.
Thank you.